Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Hechler.
And I'm Tandi Hechler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live.
Hello, and welcome to the Rev Up Health podcast. Today, we are going to fill you guys in on our most recent weekend of continuing education. We're just getting back from the Academy of Preventive and Innovative Medicine's annual academic summit. This year's title was A Powerhouse for Optimal Health.
Yeah. So this little gym here, full of all kinds of information. So this little thing is something that really, this meeting's always been very informative, and it's a yearly meeting, and of course there are a lot of other meetings they have throughout the year, but this one is a little bit more appropriate, I guess you can say, for a lot of the things that we do, Revelation Health and Wellbeing. So we're looking at that a lot of, it's not just optimizing, hormone health, it's more of optimizing metabolic health and things that you can do to optimize your overall health and well-being.
Yeah, so WorldLink Medical is also where Mark got his certification in advanced bioidentical hormone replacement therapy. So
it's certainly something that this topic is continuing to grow and expand, and there's a lot more interest now with that, and we can kind of discuss a little bit of that through some of the meetings that we went to. So kind of let you all kind of know what we did and what we didn't do. So we thought we'd kind of catch you up to speed with some of the topics that came out. And a lot of the speakers were very well versed, very knowledgeable, and very well written and published. So they are certainly heavily followed too, I might add, in the social media space even.
Yes. And ultimately, what's really great about these meetings is that you get to see the evidence behind the thought. And oddly enough, well, not oddly, I guess it's pretty expected. As we were traveling, we were also listening to a great new book that's out called Blind Spots by Marty McCreary. And what he is talking about in his new book is kind of blind spots in medicine and groupthink and conscious bias or unconscious
cognitive dissonance.
Yes.
And
that's one of the things that I think is so great about these offerings is that it really does make you think about not doing things just because that's the way we've always done it.
Confirmation bias. Yep. Cognitive dissonance. Basically, trying to create opinions and recommendations based on scientific information. And I think a lot of that you have to be very aware of, even from a scientific standpoint in the healthcare, as well as any scientific space, is essentially what kind of study is this done? What kind of study is being done? Is it an insurance-based study? Is it just an observational study? Is it a causative, study? So there's a lot of details in there that have to be read through each one of these studies to see what are they trying to prove or disprove. Because you can take a meta-analysis of any study and make it say anything you want it to say. You can prove pretty much your stance for something. So that's just something you have to be very aware, and you have to look at the outcome, the overall outcome from these types of things, and that's very important. And I think that's something that not knowing that, knowing it in the past, the way that Western medicine has been presented to you, it may be someone's opinion, and so you have to be careful how that opinion is perceived. Is it a scientifically based opinion, or is it somebody's observation of an? So you got to be very careful of that. And I think that's where the faults have been overlooked from the cognitive dissonance, confirmation bias, but that we get a lot of opinions, and we get taught this in residency, medical school or residency. And, this is just the way you need to do things. You have belly pain, you got appendicitis, you need your appendix out. Well, we can go down that path another time, but
right.
That's part of another podcast. But that's part of the that book, the Blind Spots book by Dr. McCrary, that was really important. So you just have to be aware that these studies, they all come out, and we've had the benefits of having some really good speakers at this meeting, because they may not just simply be MDs or DOs, they're PhDs, or they have the specialty interest and the bioscience, if you will, background to present these topics. And that was really enlightening to see that.
Yes, it really was. So one of the other great things about this meeting is we actually started talking about exercise.
Yeah.
It was the first few sessions.
Right out of the gate. Yeah.
I really loved.
Yeah. The physiologic basis of exercise for health benefits. That is literally the topic of the first meeting. And, it really, just to start it off, it's just kind of emphasizes and kind of reiterates a lot that we already know, is that there is certainly a role for exercise in health. There's no question about it. The cardiorespiratory fitness level is such a marker for overall health.
And longevity.
So, it kind of goes hand in hand. Good health is going to lead to longevity. So that's certainly something that's very, very important.
Yes. And so doing activity, strength training, one of the great takeaways that I got from this first session was exercise snacks, which is a term that I've actually heard before. But when you're sitting in a meeting, it becomes very, very evident that how important it is to just get up and move your body for a second.
Right. Yeah. Exercise snacks. What we mean by that is just literally getting up, doing 10 air squats. And I was telling Tandi that when I get back to the office, probably next week, I'm going to implement a program and have a sign on the break room door that is, to enter this break room, you have to do maybe, some type of an exercise snack to be able to enter that. So that might be kind of fun. I don't know how long that'll last. So, and I don't know who's going to police it. So
it's a fun thought,
but it's certainly something that makes you think,
yes.
Because that just movement, muscle movement is a metabolic improver for mitochondrial health and fitness.
And the truth is, it's not only good for your body to move it, it's good for your mind, because it gets you away from your screen or the desk or, whatever you're doing. It gives you a little bit of a mental break. So I think it's good for more than one reason.
Yeah. And I think throughout the first couple of talks we had, that it really emphasized the overall benefit of muscle fitness, the development of muscle fitness and hypertrophy with resistant exercise. It's unequivocally the number one thing for overall metabolic health, hands down. But it's certainly something that goes beyond just having bigger muscles or having active muscles. It leads to a lot of metabolic benefits, just lowering insulin resistance, which is kind of the driver of a lot of inflammatory processes and chronic disease. So, but they talk about HIIT, high intensity interval training, also in the first couple of meetings. And, that's certainly, there's a lot of opinions about that, but elevating and rising in VO2 max with that, but also, which is the body's ability to deliver oxygen, to the cells. Elevating that is very important for longevity and health also.
And there's a lot of evidence that shows that if you can, rather than just going for a sustained walk, if you were to add some high intensity, and that may be as simple as hill work or something. So,
right.
Going for a walk and knowing you're going to hit this hill, and that takes your intensity up a little bit. So it doesn't have to be what most people think of as high intensity. It could be something as simple as that.
Right. And they kind of drove the point home that everybody is at a different level in their health. And, you take an elite athlete, their high intensity interval training versus somebody that's completely sedentary, there's a difference. I mean, high intensity interval training for somebody that's sedentary may be going up a flight of steps, and that's all they can do. Whereas it may take, extended 1 mile hills or something of that nature to really to bring the elite persons up to a high intensity level.
Yeah. So it really is good for everyone of all, you can do this with any fitness level.
But they showed a significant, I don't remember exactly off the top of my head, but I think it was like when we do these short bursts, they talked about 5x1s and 2x2s. In other words, a group of 5 1-minute sessions of HIIT, or something as simple as 2-minute groups of HIIT, but just a couple of times a week. Literally, I think it was 2 or 3 times a week. Doing something like that will improve your cardiac, or reduce your cardiac risk by 30-some%. It's just incredible. And even these small little bursts, which create that, is something that's very important. So, that's something I think we can all work into, our walk. Don't just go out for a leisurely walk. Hit it hard. Walk as fast as you can, or walk up hills. And I tell Tandi that's kind of what my hits are for running. Is my hits are basically hills. I like running hills because that's a high intensity interval training, and then I get the rest break coming down the hill. So it's just a way that you kind of built that stuff in, and then you don't even think about it. So, but they also talk about how supporting a person's behavior during an exercise program is also something that's very, very important. A lot of people may have intentions of starting programs, but it's really hard to stick with some of those programs sometimes. But, you have to basically provide options and choices as a trainer or as a healthcare provider, options for them on what they can do to start. You have to kind of meet them where they are.
Yes, absolutely. And I think that is such a great thing that most providers don't get. If we're going to write a prescription for exercise or nutrition or sleep, any of these things, we have to really think about how to make this doable for the patient. And right. So it was motivational interviewing was the topic, and it's so important. And providers, nursing doesn't get this in standard school.
Right. No, you don't get it. And they speak of it in personal training that I'm doing, but it's certainly something that it's all individualized. So it really depends on the individual and how sympathetic or empathetic they are towards the patient and what the patient's capabilities even are. So, some folks may have maybe got a hip problem or they got a knee problem. And so, you can't expect them to do those exercises, and people aren't trained to do these certain things and do them correctly. So,
yeah, it's why it really is a collaboration that needs to happen in healthcare.
Yeah. And then there was discussion in the meetings about de-prescribing medications moving on. So, there's a lot of medications out there that, yes, there's the SSRIs, the PPI, and antidepressants, medications for gastric acid reduction, those things. But some of these medications can be harmful in the long term. They're helpful, yes. A lot of folks need them, and we have some great medications out there. But it's just like antibiotics. It's good for an acute situation, but it's something that you just can't chronically take. So, but they talk about the different types of effects of the medications, the SSRIs, even the diabetic medications. What's called HTC, HCTC, that basically a diuretic. Some of these medications may not be very helpful in the long run, but they're what's prescribed. There's what's out there. But the goal was to talk about trying to get folks away from prescription medications and on to a metabolic pathway for health is really what the overall gist was.
Right. And I think it is very important to just reiterate that there is a place for medications and we need them. And so, use those as we need to, and then be working on getting to a place where we don't need them and knowing how to navigate that. I think I have an example that's coming to mind of a patient who was on a GLP-1 and losing a lot of weight and wasn't followed as well as maybe they needed to be. And because they were losing so much weight, their blood pressure was coming down and no one was watching to tell them that they needed to come off of their blood pressure medicine because now they've lowered their weight and they don't need that medication anymore. And so then that causes a whole new line of issues.
Different issues and problems. Exactly. So, and there's a lot of folks on statins. There's a lot of people on, the sleep medications, benzodiazepines, the Z drugs, if you will. Even osteoporosis prevention medications, the biphosphonates, bisphosphonates. So those things can not necessarily be ideal long term. There's a lot of things out there that we can do from a functional metabolic standpoint, but also from a hormone support standpoint that I think there was I'm having a blank on that right now. I think there was we'll get to it here in a minute, but it's more of a cognitive therapy for depression was 80 to 90% more effective for controlling the depression, I believe it was, rather than the medications actually themselves. So we'll get to that here, but that's certainly something I think that was important, is just knowing that sometimes medications it's too easy to give a pill to somebody. So, and, different, for instance, there's discussion about melatonin and its importance. That was a very important topic with sleep because, they talk about sleep how necessary is sleep. More necessary than we give it appreciation for. That's for sure.
Yes. And we spoke about that. There was more than one session on sleep.
Yeah. Multiple sessions on sleep. But, melatonin is an option, the magnesium, L-theanine, GABA. There's a lot of different things that can be used for sleep. But some of the side effects of the medications that we do prescribe for sleep can be just general cognitive decline, kind of more of an addictive issue even, it's hard to come off some of those medications sometimes.
Yeah. And there is cognitive behavioral therapy for sleep also.
Mm-hmm. But, good 7 to 9 hours of sleep is going to do a lot of people a lot of good. And if you're the person that I used to be that thought, I don't need much sleep. I can get by without it. You can go to bed late and get up early and keep going and go the next day and be fine. That's not true. It's your brain needs the sleep.
Yeah.
There's a complex array of repairs that happens in the central nervous system when we sleep. And it's something that your brain just needs that reset. It's a reboot. It's like unplug it, turn the computer off, turn it back on again. Well, it doesn't work well, turn it off, turn it back on again. That's the first thing you do. So that's what happens with the brain with sleep.
And I think it's a situation where society has kind of ingrained it in us, like you don't need sleep, or, you look like you're more productive, or, do better when you don't have to get as much sleep. But the truth is, let this be your permission to sleep. Get the sleep. And a lot of us have this idea of oh, I'm lazy, or, don't think that. Yeah. Take it. Take the sleep. Yep. Take the rest.
You got to do it. And then there was some new information too, about methylation issues. The methylene tetrahydrofolate. These type of reductase, these enzymes, these are genetic mutations that occur essentially, and it causes us not to be able to methylate very well, or it just reduces our abilities for absorptions. But we'll have these elevations of homocysteine, which is one of the labs that we do check in our panel. But, you're going to see low B12 and folate levels with these types of things. So these types of things can lead to inflammation, which leads to coronary artery disease. You can have some bone mineral density issues, and it leads to something that can also be, there was some talk about migraines and folks with other types of pain disorders in general that can be something as simple as, well, maybe they don't have this methylation issues. They have the problems with it. So that's something that we all have to look at. from an inflammatory standpoint. And then, nutrition, boy, we really drove it home about nutritional support really improving our metabolic health. We are literally in an unseen, maybe a quiet epidemic of overweight and obesity. And that is driving 90% of the chronic diseases, 80 to 90% of the chronic diseases that we see. And these things are preventable. And, insulin resistance and elevated glucose levels, our daily diet consists of about 70% carbohydrates. And a lot of that's in overly processed starches and sugars. This heavily processed stuff really weighs on our metabolic system.
Yeah, it was a really good talk. Dr. Ben Dickman was there and presented a couple different sessions for us. And then Dr. Reynolds, his colleague, was also there and talked about glycation. So lots of great information on nutrition and how to help offset diabetes.
It elevates our H1 or hemoglobin A1Cs, those get elevated with that. But, just to realize that, at least 90% of the adult population is just metabolically unhealthy. And that just translates into chronic disease. So, and then, then there's of course the discussions they had about GLP-1, which we touched on earlier, but the consequences of that can be such that, why decrease GI motility? It does kind of put some people at risk for having obviously constipation or absorption issues, or, you get too high in some of these concentrations of your GLP-1 agonists, and you start having GI issues and GI symptoms and problems with it, but it promotes satiety. But its problem, I think, also is that it's not it may not be well regulated or well monitored or followed. So we know the medications work, but we've got to watch to make sure that we don't lose too much muscle mass, because 40% of the amount of weight loss that we experience by being on these GLP-1 agonists is lean mass.
Yeah. So it's just really important. Just like any medication, there is a place for it, but it's being aware of all of the details so that you can make sure that you're doing your part to make it most effective overall. Right.
And they mentioned the fact that, you can't stay on this forever. This is not something you want to be on forever. And well, I think it was 70% of the people there, if I'm not mistaken, I don't remember exactly. Should look back at my notes again. I think it's about 70% of the people in 2 years weren't on the GLP-1s anymore.
Yes, but there are some people who are on a maintenance low dose because there is some
anti-inflammatory benefits from it. Yes.
Yes.
And yes, insulin resistance gets improved. Yes, but there are things that we can do. We have to educate ourselves and educate each other about what can be done to help maintain this into the long term, and that may be something as simple as, the fats and fiber and the protein. Those things will increase GLP-1 also, but also good gut health, having a good appropriate microbiome, with the Akkermansia bacterium. That's certainly something that can elevate our GLP-1 production also and help us out. And then last but not least, the last day was about menopause, menopause hormone therapy. And, I won't go into a lot of the details about the WHI trial from 2002, but certainly it just needs to be sufficed that menopause is basically an estrogen reduction. And that's going to lead to cardiovascular disease, bone loss, sarcopenia, sexual dysfunction, UTIs, but cognitive decline. And even may increase your risk for certain types of cancers by having estrogen deficits too. So for a female, it's very important for them men too, but for females specifically, hormone replacement therapy is a good thing. And there's a difference that what we really wanted to point out is that there's a difference between estrogens and there's a difference between progestins. They're not all created the same. There's the bioidentical hormone replacements, which we've talked before about, and then there's the synthetic forms. So the bioidentical hormone replacement forms are the ones that have got the better track record. And there's no reason to be scared of those. They are going to improve a quality of life for a female going forward into the adult years, period. There's absolutely no reason to be scared of these things. And if a person wants to be on them, they can. If they don't want to be on them, they don't have to. But it depends upon what quality of life you want.
Yeah. And I think we're hearing more about that all the time. And I know we are going to continue to hear more and more.
Yeah.
And they're going to be doing more studies, I think.
Yeah. There'll be a lot of studies coming out for sure. So, and, there was a recent paper that actually one of the speakers had and so she talked about that, the differences and what the original study had said and how it kind of just got snowballed into the media and it scared people away. And so as a result, literally hundreds of thousands of women are going to lose their life and have issues from a lack of hormone therapy going forward. And that may be an exaggeration, but I don't think it is, because when you start thinking about the osteoporosis fractures, the cognitive decline, just the cardiovascular risks that go with a lack of estrogen into the later years of life, it makes a huge difference. So
that kind of sums it up. That's our 2.5 day education event in a nutshell. So just wanted to give you a peek inside of the things that we are learning and excited about and, open to hearing more about.
And that's the thing about it too. We talk about this all the time. This is a process. It's an ongoing process. And if you get into the idea of cognitive dissonance or confirmation bias, that this is the way you've been taught and this is the way it is and this is the way it's going to be, it's hard to get out of that. So you really need an open mind and you need to be aware going forward, this process is going to have updates. It will continue to have updates. All the information we gain now in 10 years, who knows if it's going to be more important or less important. There may be something else, but it's certainly a process of updates. But we really like it. This is why we do this stuff, and we hope that we can provide a little information and insight on how people can improve their metabolic health.
Yeah. Thanks for tuning in. We'll see you next time.
Bye-bye.
Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.